An upcoming report from the Department of Health is expected to link the development of autism in children to a common over-the-counter pain reliever. According to a Wall Street Journal report, the drug in question is Tylenol.
Yeah, that's right. 9 News health expert Dr. Payal Kohli is joining us now to break all of this down for us. Dr. Kohli, thanks for being with us.
Good morning.
So first of all, what have the trends been in autism lately and why?
You know, there are a lot of questions around autism because we're seeing an increased incidence of autism. So just about 5 years ago, we had 1 out of 36 children on average diagnosed. Now it's down to 1 out of 31. So
Wow.
Think about an average elementary school class. Chances are that a kid there has autism. And there's a few reasons for this. One is they've actually expanded the diagnostic criteria. So more kids now actually meet the diagnosis of autism than they did several decades ago. We're screening better, but we also think factors like advanced maternal age and advanced paternal age are actually playing into the development of autism, which we're seeing much more common.
Can I ask a quick follow-up right here? When we're talking about kids with autism, what age group are we talking about specifically?
Usually around elementary school, we start to meet the diagnostic criteria. Now, it can be diagnosed at any age, even older kids. But around the time, and this is where that erroneous link with vaccines came from, around the time they start to get their vaccines between 4 and 6 is when we start to see many of those factors emerge. Now, some kids who have more neurodevelopmental problems, ADHD, you can start to see some of those behavioral issues even earlier.
So what do the studies say when it comes to autism and pregnancy and Tylenol?
Yeah, so more than half of pregnant women take Tylenol during a pregnancy. Did you take it during yours?
Probably.
Yeah.
There's a lot of aches and pains.
Well, and it's considered sort of the safest thing. It's our first line recommendation for pregnant women. But a few years ago, around 2021, some experts wrote a consensus statement saying that there may be a link between Tylenol use and autism and other neurodevelopmental disorders. So this raised a flag. So there have been a couple of recent studies that came out. One was a large meta-analysis. That means they put together a bunch of smaller studies. 46 smaller studies. Out of this, 27 showed a possible link, 9 were neutral, and 4 showed possible protective benefits of Tylenol. So the data there was really mixed. And then last year in the Journal of the American Medical Association, over 2 million kids in Sweden studied. This was a great study because it did something called sibling control. So that controls for genetic factors. It means it looked at siblings who didn't get exposed to Tylenol and, you know, the child who did, and looked to see if there were any differences in autism rates, and there weren't. So we in the scientific community feel that the sibling control kind of controls for other factors that may be explaining the association.
Is this only in your utero that they were looking at, or like if you gave infant Tylenol to your kid when they were, you know, little, is that part of the study at all?
Nope. So I was looking mostly at mom's exposure.
Okay.
And we know that Tylenol crosses the placenta. We know that it can create oxidation and such, and this is one of the reasons we've asked this. But let me ask you, why do you take Tylenol?
Pain relief. I mean, and you need it.
Pain or fever
Yeah.
or migraines
Right,
or autoimmune disease. So really the question here becomes, is Tylenol use just a marker for mom having some other problem? All of which we know, including pain, is linked to problems. And the Tylenol itself is not causing the problem. So that's the classic causation versus association. Is Tylenol just a marker for something else?
So is that why the FDA then is changing its stance on Tylenol during pregnancy? Is that association that you were just describing?
So that's why the FDA said we can't conclude that it is. So in 2015, the FDA looked at all the data, but now we're hearing the HHS might actually change this stance, which I think is really alarming because the American College of Obstetrics and Gynecology, the Autism Science Foundation, multiple other societies have really said there's not enough science to say that this is causing it. And now you're getting rid of one of probably the safest pain relief option for pregnant women, leaving them with more dangerous options potentially.
Is there, I mean, like if a mom's sitting at home, she's pregnant, and she, you know, aches and pains come up when you're pregnant, what do they do now with this information?
So pain can be bad for baby too. So really don't stop taking Tylenol if you've been taking it. Talk to your obstetrician and gynecologist and see what they say. But at this point, the American College of Obstetrics and Gynecology has issued a statement saying Tylenol use is safe. People shouldn't be afraid of taking Tylenol. We haven't established causality, but certainly the HHS is asking these questions.
Something else that might be mentioned in this report is folic acid and folinic acid.
Yes.
Can you explain the two of them and the difference there?
So folic acid, all pregnant women should take because it's important for DNA development and repair. And we know for a fact that folic acid deficiency in pregnancy, especially in the first trimester, can increase risk for neural tube defects and other neurodevelopmental disorders. Some women don't don't activate folic acid to folinic acid because they have mutations and such. So certain subset of women should take folinic acid, and your GYN or OBGYN will tell you if that's you, because it's the activated form of folic acid. And again, it protects against neural tube defects and such. Certainly if you have a deficiency of folic acid or folinic acid, your baby is at higher risk for having developmental problems. So this is something we usually recommend for all pregnant women. It's included in most prenatal vitamins as well.
Is that just a blood test to see if you need the folinic acid?
It's
do
a
they
blood
know?
test. Yeah,
Okay.
It's exactly right. It's a blood test, or if you've had other problems, if you've had a baby before with neural tube defects, you know, you carried a pregnancy where the baby had defects, even though you took folate, then these are all signs that you might need folinic acid as well.
So interesting. All right. Well, Dr. Kohli, thank you so much for coming in. Appreciate it.
And if you want to check out any more of Dr. Kohli's segments, you can go to 9news.com and stream them also on the 9 News Plus app. Dr. Kohli, thank you.